Ever heard that vaginal discharge is something to be concerned about? Well, it's time to debunk that myth. Vaginal discharge is a normal bodily function, acting as a self-cleaning marvel of your reproductive system. It carries away dead cells and bacteria, keeping your vagina clean and preventing infection. Now let's talk variations. The appearance of discharge can change based on several factors. Age, for instance, plays a role. A woman in her reproductive years may notice a different consistency compared to a woman in her menopausal years. Then there's the menstrual cycle. Ever noticed a clear, slippery substance around the middle of your cycle? That's your body's natural way of promoting fertility. Hormonal changes too can cause fluctuations, so remember, not all discharge is a cause for worry. It's part of your body's normal functioning. The key is to understand these variations and be alert to any changes that don't fit your personal norm. So, now that we know vaginal discharge is normal, what separates the usual from the unusual? Well, let's first describe the characteristics of normal discharge. It's typically clear or milky and may have a slight odor. Its consistency can vary from thick and sticky to thin and watery, depending on the time of the menstrual cycle. Furthermore, hormonal changes, age, and even your mood can influence its appearance. So, it's important to remember that a wide range of normal exists. Now let's contrast this with abnormal discharge. If you start to notice changes in color, perhaps it's becoming green or gray, or if the texture becomes frothy or cottage cheese-like, these could be signs of an issue. Similarly, an increase in volume or a strong, foul odor can also indicate a problem. These changes could be due to a variety of factors such as yeast infections, bacterial vaginosis, sexually transmitted infections, or even cervical or uterine issues. It's also important to note that these changes may not always come with other symptoms like itching or burning. The key takeaway here? Don't ignore these changes. Don't rely on a quick Google search or an old wives' tale. If you notice any of these changes, it's crucial not to jump to self-diagnosis. Your body deserves expert care. Wondering what could cause these changes in your discharge? Let's delve into it. Abnormal discharge could be a sign of various conditions. One common cause is yeast infections, also called vaginal candidiasis, which usually come with a thick, white discharge, almost like cottage cheese. There is also intense itchiness of the vagina and the vulva. Then there's bacterial vaginosis, another common infection that results in a grayish-white discharge with a fishy odor, vaginal itching and pain during urination. Sexually transmitted infections like gonorrhea and chlamydia can also cause abnormal discharge, often yellow or green, and might be accompanied by other symptoms such as pain and burning sensation when peeing. Lastly, issues with your cervix or uterus, including cervical or uterine polyps or even cervical cancer, can lead to abnormal discharge of brown, red or yellow. They also cause irregular vaginal bleeding. Remember, these are just a few potential causes, but each woman's body is unique. That's why it's so important to consult with a healthcare professional. You might be asking, how can I prevent abnormal discharge and when should I seek help? Well, there are several steps you can take to maintain a healthy balance down there. First and foremost, avoid irritants like scented soaps, bubble baths and douches. They might smell nice, but they can disrupt the natural pH balance of your vagina, leading to abnormal discharge. Next, practice gentle hygiene. Overwashing or scrubbing can also lead to imbalance. A bit of warm water and mild, unscented soap is all you need. And ladies, always remember to wipe from front to back. Another useful tip is to wear cotton underwear. Cotton is breathable, which helps to keep the area dry and prevents the growth of yeast and bacteria. Now, it's important to familiarize yourself with your own personal baseline. You see, vaginal discharge varies from person to person and can change due to hormonal fluctuations throughout your menstrual cycle. So take note of what's normal for you and be aware of any unexplained changes. Spotlight on when to seek urgent care. If you notice a foul odor, unusual pain, or heavy discharge with clots, these could be signs of a more serious issue and warrant immediate medical attention. Remember, your health is in your hands. If you notice any persistent changes, don't hesitate to consult a doctor. Your body, your health, your responsibility. Don't forget to like, share, and subscribe to our channel for more enlightening health topics.